Hello dear and welcome. This is the FCT Call Center on NASA Radio and Television Services. I am Hulina Adojo. On FCT Call Center, we bring to you the activities of the secretariats, the departments, and the agencies of the Federal Capital Territory Administration. This program also gives residents of the FCT the opportunity to participate in governance, and this is done via phone calls. Today on the program, we have from the FCT Health Insurance Scheme, Dr. Salamutu Belgori. She's the Acting Director of the FCT Health Insurance Scheme. Thanks for joining us on the FCT Call Center.
Thank you very much for having me.
We also have a regular of the House. She is the Deputy Director as well as the Head of Operations of the FCT Health Insurance Scheme, Mrs. Hawawu Jimo. Thanks for joining us.
Thank you.
FCT Call
Thank
Center.
you. Thanks for having me.
You can follow FCT Call Center. We are on DSTV. We are live on DSTV channel 392. We are on Star Times TV channel 127, and we are also on Free TV channel 507. You can also listen to us on ASO Radio 93.5 FM, Abuja. Stay with us. We'll be back after this time out.
And if we open our eyes, we would realize we are a nation blessed with people of diverse cultures, religions, languages, and opinions. It is ironic that we are now being ripped apart by our greatest strength, our diversity. We have allowed intolerance, insensitivity, bigotry, and nepotism to blind our vision of the greatness we can achieve working together as one. We may not have the same culture, nor religion, nor language, but we all belong to this by ignoring the questions that beg for answers.
We and operators of ASO Radio 93.5 FM Abuja, ASO Television DSTV channel 392, Star Times Terrestrial channel 127, Free TV channel 507, People's TV channel 285.
Thanks for joining us on the FCT Call Center. Today we have from the FCT Health Insurance Scheme, Dr. Salamutu Belgori. She's the Acting Director of the FHIS. Once again, thank you very much for joining us. Now, how do you persuade employees, dependents, and residents of the FCT to enroll in the health insurance scheme? That's the FCT Health Insurance Scheme, which I believe is different from the NHIS, that's the National Health Insurance Scheme, because asking people to pay for healthcare services when they are not sick is a serious situation to deal with. So how do you manage? How do you persuade residents to enroll in the scheme?
Thank you very much, Lina. I would like to first of all say thank you very much to the FCT Call Center for this very laudable initiative and for giving us an opportunity as the FCT Health Insurance Scheme to reach out to the people and let them know what we do, how we do it, how they get to benefit from the services, and how to access the services. Yeah, so the FCT Health Insurance Scheme is a social health insurance scheme that offers financial protection to all residents in the FCT through financial protection to all residents in the FCT through the provision of quality healthcare services by the healthcare providers. Yes. So, and convincing people actually to, okay, the insurance scheme actually has various programs. We have the formal sector and we have the informal sector. For the formal sector, we have most, I can say all formal sector employees of the Federal Capital Territory Administration are enrolled in the scheme, and then we have the area council formal sector staff as well enrolled under the formal sector scheme, and then organized private sector, and then in the informal sector we have individuals We have the poor and vulnerables, which are captured under the Basic Healthcare Provision Fund, which is supported by the federal government. And then we also have organized private sector, and I think, yeah, that's it. And the community-based health insurance claim, that's for the informal sector. So what we do to convince people to pay for healthcare when they're actually not sick is a lot of sensitization and awareness creation programs. And you know, asking somebody to pay for health insurance when he's not sick, you actually have to convince them, to make them understand that you're actually saving for unforeseen circumstances, in the sense that we are all human, and it's inevitable along the line at any particular age to be ill. Ill health is you can fall sick, and you can come down with communicable, non-communicable diseases, which could happen at any time. It's unpredictable. So, but if you're saving ahead, you're paying for health insurance. When you fall sick, you have something to fall back on, such that you don't have to, your family doesn't have to go into financial hardship to be able to pay for the healthcare services that you need when you actually need it. And then for those that eventually do not fall sick, which is unpredictable, we take it like you're actually paying for helping those that actually fall sick, since we all pray not to fall to have ill health, you know. So those are part of the messages that we pass across to people, to let them understand the concept behind the health insurance scheme.
Okay. Now, Madam Awawu, some people will say, God forbid, my beliefs, in fact, it's like I'm predicting I'll fall sick. Why do I have to pay for health care when I'm not sick? How do you convince people to do that?
Thank you very much. It's a very important question. As we all know, health is wealth, and nobody prays to be sick. But as human beings, we are bound to be sick one time or the other. So insurance, as my director has rightly said, gives financial protection to enrollees. So when you are doing that, you are indirectly trying to save for the future, so as in case of any health emergencies that may come your way, you will not be caught in a financial stress or embarrassment. So that will take care of you. So we try to tell them what they are entitled to convince them to come into the scheme. Like if you are enrolled either from the formal or informal sector side, you are entitled to healthcare prevention and promotion. You are entitled to maternal and child care services, like those that are still in the bracket of giving birth, deliveries, and all those things, pregnancy-related issues and babies. Then you are entitled to emergency services. You are entitled to basic surgical, medical, and other ancillary services. You are entitled to laboratory services and other investigations. And these are services that you are entitled to, that in case you are in need of them, you don't need to start scouting for money to pay for your medical bills. Your insurance takes care of it. So, and we sensitize them, you know, we organize awareness campaign to our SDAs, gathering our FCTA employees, tell them what insurance is, how it operates, how it benefits them. We engage stakeholders to come from various, the community level, the religious level, and even the stakeholders back in our FCTA as administration. We gather people, tell them what insurance is, how it benefits people, what it means to sustain the program. So that is how we encourage them to come into the scheme.
Now, can we have what is the level of enrollment like? Can we have a figure, a statistics presently?
Okay, so presently, as at October 31st, we have a total of over 196,000 enrollees in the FCT health insurance scheme. Majority of them constitute the formal sector enrollees, and then we have the minority from the informal sector.
Okay. Now let's look at the measures the FCT health insurance scheme has put in place to ensure that HMOs deliver prompt services when needed, because in most of the health facilities visited, we have first-hand information that HMO delay in approvals to enrollee. What measures have you put in place to curtail that problem?
Okay, so thank you very much. We have structures in place to monitor the activities of the HMOs and as well the healthcare providers, whom are our major stakeholders. So for the HMOs, we have what we call the call center at our office at the FHIS. The call center and the operation center are saddled with the responsibility of taking calls, distress calls from enrollees, from HMOs, from the healthcare providers, and addressing the issues promptly. We have a 24-hour call center, and they attend to those issues as they arise, and issues are being resolved as as they come on board. And then we also have what we call quarterly. We have meetings, regular meetings with the HMOs and as well with the healthcare providers. We are even planning our next quarterly meeting with the HMOs next week. So there we have like an interactive session. We have data-driven findings, and we discuss the challenges, the issues that arise, the enrollees, the feedback that we get from them based on client satisfaction surveys. So we discuss all that, and we get to have all the HMOs be in tune with what issues clients or enrollees are complaining of from the various HMOs, and we try to see how we can best we address them in line with global best practices.
Okay. And when we have had cause to disturb you sometimes in the hospital, how, from your own perspective, what has the FCT health insurance put in place to check this problem? Because most times you find people queuing up at the health insurance scheme office, waiting for days for approval. So what measures is the FCT health insurance scheme taking up? What measures have you put in place to check that problem?
Okay, in addition to what my director has enumerated as the measures in place, we have gone around as a regulatory body we have visited all the HMOs to ensure they have a standard call center in place, manned by qualified personnel. One thing is for hospitals to request for authorization, and at the other end is another thing for somebody to respond in time. These are things that required real-time response from both ends. So when there are issues, they call the call center FHIS, where we mediate within these issues to give real-time response to any of the enrollees that is in need of this authorization. So that we have done, and we have sanctions. We sanction any of our enrollees or even healthcare provider that is playing with our enrollees in terms of service deliveries. So we have had courses, to write our HMOs. You need to sit up. If not, things like this, these actions will be taken against you. And that has really addressed the issue. Then on the part of the healthcare providers, we have trained them. We usually give quarterly training to desk officers. We are about doing the last one in the last quarter, to train them on how to request for authorization. There are mediums. You don't just call or send for authorization. A particular HMO will say, okay, we want email or our messages through WhatsApp. So we have trained them on how to do that and how to check to get their feedbacks. Not sending requests and you relax, waiting, and while the enrollees are there suffering. So meanwhile, the request has been attended to. So on both sides, we have taken measures. And even in terms of facilities, those that are not forthcoming in good service delivery, we have had courses to delist some of the primary healthcare providers that are found wanting, and we are still doing that. So both sides, they have been trying to sit up, and we have seen improvements in that side, in that sector.
Okay. Acting Director, sir, Ma, what are the classes of enrollment classification? Can you classify the types of enrollment we have in the health insurance scheme?
Okay, for the FCT health insurance scheme, we have the formal sector and the informal sector. So in the formal sector, we have enrollees from the FCTA, from the area councils, and then organized private sectors. And then for the informal sector, we have individuals. You can come up as an individual, pay 13,500 naira and for a year, and you get enrolled under the health insurance scheme, and you get to access all the services that has been mentioned by my colleague here. And then we have other groups like the Basic Healthcare Provision Fund, which caters for the poor and vulnerable. This is sponsored by, the funding for this is catered for from 1% of the Consolidated Revenue Fund from the federal government. So we get the funding from the Federal Ministry of Health through the NHIA gateway, and then this pays for health insurance for the very poor and vulnerable people in the nook and crannies of the communities in FCT. So under this scheme, we have over 36,000 poor and vulnerable people in the communities in FCT that have been enrolled under the Basic Healthcare Provision Fund, and they access services through the primary healthcare centers at no cost to them. They're not paying for the services. Federal government is paying on their behalf. And then we also have, when they need secondary care services, like for those that are pregnant and cannot deliver normal delivery, they are referred to secondary healthcare facilities, and the payment for their services for the cesarean section and all that is also catered for through the Basic Healthcare Provision Fund when we receive the claims from the secondary providers. So we also have, under the informal sector, we have other groups like the community-based health insurance scheme, and I think basically that's it.
Okay.
Yeah.
Now to my next question. The Fct Call Center has received complaints, and we've also experienced a first-hand experience. We've also had first-hand experience in some of the health centers visited, where enrollees have complained that they do not get the value of the money they spend when they visit the hospitals. Like most times when they prescribe drugs for you and you go to the FCT, you go to the health insurance pharmacy, they will tell you that these drugs are not covered, or the laboratory examination, they will tell you it's not covered, that you have to pay for them outside the hospitals. What measures is FHIS putting in place to check this?
Okay, thank you very much. So the issues around drugs for the health insurance scheme is actually not a new thing, and it's not peculiar to the FCT alone. But I'm happy to say here that the FCT Health Services and Environment Secretariat, headed by the Mandate Secretary, Dr. Adedolapo Pasawe, and the Permanent Secretary, Dr. Babagana Adam, with support from Honorable Minister, have they've taken a lot of steps to address the issues of drugs, insufficiency of drugs in the healthcare facilities. So we've had series of drug revolving fund meetings, where the pharmacists and the MDs of the secondary facilities have come on board to see how well and how best to address issues around shortage of medications in the healthcare facilities. And with this, I'm happy to say now, as at the last meeting that was held, that from very low percentages of drug availability and even at times no drugs, we now have over 60 to 70% of drug availability at the healthcare facilities. So I'm pleased to say that, and encourage you to also to go to the healthcare facilities, and you'll see that the narrative is actually improving and things are changing. As well, the Honorable Minister has obliged us and has approved and the payments of most of the outstanding capitation and fee-for-service premium payments to the healthcare providers. You know, over 90% of capitation has been paid. In fact, the fourth quarter capitation was just paid last week to the HMOs, who are in turn meant to pay to the healthcare providers. So issues of outstanding payments is now becoming a thing of the past, and with time, by hopefully into the middle of next year, we'll be able to stabilize and get to ensure that premiums are being paid as at when due. And that would also help with the issues of availability of drugs at the healthcare facilities.
Okay. Yeah. Now to Madam Hawaii. Yes. She mentioned drug revolving fund. Yes. To a layman who is watching and listening to us and doesn't understand the term revolving fund, could you please explain further?
Okay, thank you very much. A simple time, drug revolving fund is a system put in place, or a structure put in place by the FCT administration, where drugs are purchased in bulk, kept and disbursed to facilities. And the funds recouped from that is used to purchase drug, and kept there. And that is being done repeatedly so as not to ensure that drugs have stable supply. The facilities have stable supply of drugs, so that the patients will have something to access when they get to the hospital, so that there will not be shortage. So that is the main reason in putting up that drug revolving fund in place, usually manned by our Abuja ACMS. We call it ACMS, Abuja Medical Store, that disburse these drugs to facilities. And patients are paying for these drugs. Like those on insurance, they pay 10% of the cost of their drugs. And these in turn go back to the purchase of those drugs to restock in that facility.
Now, acting director, we are still on drugs. Yes. Most times when you visit the health insurance pharmacy, some people have had cause to complain that they have given me the drugs they count, not the ones in a packet with their name branded drugs. Could you please explain the difference between the branded drugs that people prefer and the ones they count in the hospitals? Okay, so is anything different between these drugs? And most times when they give you the branded drugs, they will say they don't have it. Go and buy it outside the hospital facility.
Okay, so actually I think it's just a thing about perception. Because the drugs, for example, if I want to use an example of an antibiotic called azithromycin, or let me go for the layman to understand, we have what we call ACTs for treatment of malaria. So the ACTs, you could have, that's artemisinin-based combination therapies. You could have Coartem, you could have Lonart, you could have Locmal. They are different brands by different companies, but the constituents are the same thing. But there's this perception by the people that if you get the branded one, like for Augmentin now, if you're not getting Augmentin, then and you're being prescribed Fleming, they perceive it as being like an inferior quality medication. But in the real sense, it's actually not inferior quality. It's just about the name or the companies that are producing these drugs. Some of the companies have made name. They have, they've been around for a while. Some are new. But the constituents of those medications, the efficacies, the functioning of those medications, as long as the properly stored and kept and within proper expiry dates and all that, that are not expired and all that, it's the efficacy and the functioning of the functions of the drugs in the system to treat ailments is the same thing. So we need to change the perception of the people that it's only the branded medications that would give them the desired results. No, it's not so. It's actually, it's just a perception. It's just a thing of perception. Yeah. So, thank you.
Okay. DB and Head of Operations, this question is specifically to you. Now, that's your field. What level of sensitization do you provide about the scheme and its services to residents of the FCT?
Thank you very much. FHRS as a body has gone, or as an agency, we have gone into sensitization massively across FCT using different media. So we have done enlightenment campaign and sensitizations across SDS. We have done enlightenment campaign and sensitization across SDS. We have gone to marketplaces. We have gone to religious places, churches and mosques, gone to market organization, all these artisan groups. We have gone into sensitization and campaigns across in different on different occasions. So we have equally, had some engagements with the stakeholders, bringing them together quarterly, sensitizing them, that is the key players in the sectors, sensitizing them, and even the traditional rulers in some communities, heads of organizations, all these youth groups, women market organization, their heads, we have gathered them, we sensitize them to go back and resensitize their own subjects. We have a program, FHRS and You, that runs weekly on radio. It's a tune-in station where we are, and a release call in to ask questions, and they are giving real-time response. And we have a magazine, monthly magazine, that a bulletin that goes out there to the public, yes, news bulletin. Then we have our flyers that we give out using any program at all. We key into programs organized by any of the organizations in FCT, or even a government, or even if it is not government, we key in to sensitize the public. And we had equally gone as far as establishing our area council offices in the 6 area councils to get closer to the grassroots and the communities, even the hard to reach communities, so that we can mobilize and reach them, for all of them to key into insurance. So that we have done. And we are on all the social media handles, the Facebook, the Twitter and the rest. So we get questions, people ask us questions, all this we are into it just to sensitize our public to come into insurance. Soon as far as you are a resident of FCT, there is nothing holding you not to key into insurance, both formal and informal sector.
Now, Dr. Begurima, how can the FCT health insurance scheme enhance the overall health of residents of the FCT?
Okay. So the way we work, the way we function, is and the way we get sensitized, all our activities is what eventually culminates into the overall health and well-being of the citizens. So we have operational guidelines. We have key stakeholders that are made to adhere to these guidelines, so that we carry out our activities in line with our annual operational plans, strategic operational plans, to benefit package. We're also guided by the National Health Insurance Act 2022 guideline. So we carry out our activities in line with the rules and regulations in those guidelines, in order to ensure that we're practicing in line with global best practices. So when we do that, our activities are in tandem with what we're supposed to do, and as well, we do a lot of data-driven review and we analyze our data to ensure that we find out what the issues are, what are our challenges, and then how do we get to resolve them. And as well, that way we are able to assess ourselves, track our progress, get feedback from our stakeholders, especially the enrollees, and then that way we try to see how best we can ensure that the health and well-being of the citizens of the FCT is assured. Yeah.
And finally, before we go, what are the major challenges of the FCT health insurance scheme?
Okay, challenges. The major challenges we have is with issues around the human resource for health. It's not peculiar to the health insurance scheme alone, because when we get to the healthcare facilities, you realize that there's a shortage of manpower to actually provide the services to the people, and at the end of the day, that results in delay and long waiting hours in accessing care. So that's one of our major challenges. Everybody knows about the Japa syndrome. It has affected the health sector in a very large way. And then we also have challenges around the fact that our processes are not yet fully digitalized. So, and we're in the process of getting that done. So I'm hoping that by the time we digitalize the processes end to end, we have a robust insurance solution. We're able to track claims management processes. We're able to it will make us more efficient and more effective as an organization, and then we're also able to get real-time feedback and address issues, in a more effective and efficient manner. Another issue that we have, which is not also peculiar to the health insurance, is the issues around funding for healthcare, financial resource allocation to health, not just health. Resources are not are usually very scarce. So within the scarce resources, what we have allocated to health and invariably to insurance is still inadequate. So, and by so doing, we don't have, we're still working towards having more resources coming to health, so that we can also be able to, have the financial leverage to carry out more and more of our activities, and also as well enroll more people into the health insurance scheme. And this also has to do with partly with our autonomy as the health insurance scheme, because the bill for the insurance scale in the FCT is yet to be passed. So, getting that bill passed would also help us to be able to have some level of autonomy in terms of human resource, in terms of financing, in terms of the structures, and in terms of the overall productivity of the scheme.
Okay. Now, finally, Madam Hawaii,
Yes.
how can residents of the FCT reach the FCT health insurance scheme? Through phone calls, your office address, how can they reach you for complaints and answers to their questions?
Okay, thank you very much. First of all, our office is now located at number 5, Port Harcourt Crescent, off Gimbia Street, Area 11, Karki, Abuja. Let me take it again. Number 5, FHIS is located at number 5, Port Harcourt Crescent, off Gimbia Street, Area 11, Garki, Abuja. Then we have our call center lines. I'll read them out. Even though the first 3 lines, I'm going to read out the MTL lines that we have. We have some challenges now. We all know the MTN is doing revalidation of their phone numbers. That you can't reach us for now, but in a short while it will be true, because we are working on recovering them back. So I will read them out. Meanwhile, we have 2 new Etisalat lines that is operational. I will give it out at the end of this program, so that they will put it on our social media handles while we are waiting to get our MTN lines back. So I'm reading out the lines. You can still take it down. You can reach us on it any moment for next month. We are working on between now and the end of this December. I believe our MTN lines will be back to functioning. The first one goes thus: 081 04 54 55 02. Then the second one is 081 04 54 55 04. The third one is 070 422 44 000. That's 000. These are the 3 lines. You may call it now and not getting us, but we are working on recovering them. Then there are 2 new Etisalat lines, and that I'm going to drop it. I don't have it offhand now. Okay. Bag.
I will get back to you.
Okay. So, and we even interact. Okay. Sorry, the Etisalat lines. I have 090. Sorry, I'll give it out. I don't want to read out a wrong number. The phone is so dark. And you can equally meet us and give us complaint in our office at the call center unit at Area 11. You can call us. Everybody, most of FHIS release, they have my number. Most of our staff, they have our number. Please, if you are at the hospital and you have problem, don't leave there. Always stay in the facility and make call, so that we can investigate and give you a real-time response. By the time you have issues and you don't call us, you leave the hospital in anger, and on getting home you are calling. We might call to investigate for that action, and there will be denial. So please, we encourage all our training and release out there. When you get to your hospital, there are issues, please stay there and call us. Thank you.
That's the size of our package today on the FCT Call Center. Thank you very much. The Acting Director, FCT Health Insurance Scheme, Dr. Salamatu Dogoro. Thank you for coming on today's edition of the FCT Call Center.
Thank you very much for
and thank you very much, the Acting Director, Deputy Director, and Head of Operations of the FHIS, Madam Hawawu Jimo. Thank you for coming on the FCT.
Thank you for having us. Thank you.
Do join us for another edition next week. I am Olina Adojo. Thank you very much for staying with us.
And UHF Channel 30.